right, good morning, good afternoon, good evening. Depends on where you are connected from. My name is Emmanuel Adegbola. I'm so excited to co-host this show once again today. And I would like to welcome all of you to Keyna Health Show. Today we are going to be discussing very important topic that is, that plays the major interest of David Omenukor Foundation and of course Keyna Health Show. So I'm not alone today. I have panelists that are going to be discussing. Of course, I have the representative of David Omenukor Foundation from Nigeria and even right in United States. And of course, the host herself also is here. So we're going to get started. Let me bring in our guest, our main guest today, to say hello to our viewers, even as he just keeps smiling. Over to you, Dr. Francis.
Hello, everybody. Again, my name is Dr. Francis Nwafo. I'm a board-certified urologist. We treat a lot of prostate cancer. We also treat a lot of other diseases like kidney stones, urinary incontinence, erectile dysfunction, enlarged prostate, you name it, kidney cancer. We treat all that. And I have a very good news. Dr. Egwo just texted me. He said his flight was delayed, but he will be joining us in about 10 minutes.
Awesome.
So that's really good. That's me. I'm located here in Dallas, Metroplex. Our main office is at 20 Northgate Drive. It's in Waxahachie, Texas. We are affiliated with Baylor, Scott and White, Ennis Regional Hospital. I've been in practice since 1997, and I'm glad to be here.
Awesome. Just quickly reminded me of when I left high school. I always thought I was old, but now I just remember that I'm still young. Thank you so much. Okay, over to you, the representative of David Omenukor Foundation Nigeria, reporting all the way from Nigeria. Say hello to our viewers. You are muted. Okay, let me unmute you. Go ahead.
Okay, thank you, Dr. Emmanuel. Bright Ugochukwu is my name, and I represent David Omenukor Foundation here in Nigeria, and I'm glad to be on the show. Thank you.
Good to see you, even though I can hardly just see your face. The whole thing is blah, but at least we can hear your voice. That is what matters most. Good to see you. Okay, over to you, Mr. Alex. Say hello to our viewers.
Yeah, good morning, good evening, good afternoon, depending on where you are. My name is Alex Nwahiri. I'm a co-host and a representative of DOF here in the United States. You're welcome to the program.
Awesome. And before I bring in the host, we introduce today's topic of discussion, I believe we should usher our in with what David Omenukor Foundation is doing back home in Nigeria.
David Omenukor Foundation. Global Crusade Against Cancer. The 2021 free mammogram exercise by David Omenukor Foundation started on the 22nd of October in partnership with Everite Diagnostics. The CEO of the foundation, Dr. Keyna Omenukor, flagged off the free mammogram exercise.
There is no better time to do breast cancer screenings than Pink October. This is the month that has been reserved for breast cancer awareness. So that's why we chose October to give these free cancer screenings, mammograms for individuals. We're also using this opportunity to educate them on other measures that they need to take to stay healthy, to reduce their risk for breast cancer.
The free mammogram program this year cuts across the 27 local government areas of Imo State and beyond as early as 8 a.m. in the morning. Beneficiaries started arriving in their numbers. One spectacular occurrence this year is that in a bid to solve the issue of long distance, Omenukor Foundation provided buses to pick these women from their homes, especially in Abombise, Ayazo and Ezinihite local government areas of Imo State. The representative of Omenukor Foundation here in Nigeria had series of health talks before the screening proper.
Qualify for this screening, you mustn't be below 40 years and you mustn't be diagnosed of any form of breast cancer in the past or lumps in the past, because this is a screening to detect what has not been in place.
Many testimonials for this year's free mammogram followed as beneficiaries collected their results as well as the films, while others were referred to the oncologist for further investigation.
My name is Chidima Amuneke. I first of all want to commend Omenukor Foundation for this exercise, and I just had a mammogram now. So now that I've had it, I can't wait to have my results and I would know my status. So I'm encouraging every woman out there, come and know your status. Whatever it is, positive or negative, is for your own good.
My name is it's okay. There's not much from what I had. I thought it was painful, but I got that. It was just normal. There's nothing to be afraid of about it. It's just examination of the brand. Before you know it, it's over.
Peter Priscilla Akuna. Well, I think I've been hearing about this, and the opportunity has not come for me to do this. And a few days ago, I got the information, and I was asked to be here.
All right, over to you, Dr. Keyna.
Hello, everyone. Hello, our viewers from all over the world. Here we are again. Welcome to Keyna Health Show for this episode. Cancer remains a deadly disease, and our goal and objective is to show the world how you can avoid, reduce your risk for getting, being a victim of cancer. World Cancer Day, which is usually February 4th, is a day marked by the Global Cancer Society to encourage everyone, individuals, organizations, to engage in strategies to prevent, detect, and treat cancer of all forms. So today, I'm happy to have Dr. Nwafo here again today. He is not new to the show, and Dr. Agarwal is on his way. He will join us, I think exactly a year ago, Super Bowl day, we had the same topic. So today we are going to dive into what we can do to reduce the scourge of cancer in the society. Welcome to the show.
Awesome. Over to you, Mr. Alex, as you pioneer the keynote of today's show.
Yeah, Dr. Keyna has already told us what World Cancer Day is all about, the objectives, the aims, creating awareness, letting people know, and all that. So we'll go ahead to ask, why is cancer regarded as a very dangerous disease? Because you can see everybody is gathering. There are a lot of push, there are a lot of advocacy against this cancer. So let me ask Dr. Nwafo, who is in that area of specialty, why is everybody dreading cancer? Why is it so regarded as a very dangerous disease? Dr. Nwafo.
Well, yeah, thank you for inviting me on this show. Again, I really commend you, the organizers, for bringing awareness, to the cancer issues. Cancer doesn't differentiate between races. It doesn't differentiate between religion. It doesn't differentiate between rich and poor. And it has been a continuous challenges in our world, today. Why is it dangerous? Why it's dangerous is because if we don't do screening, if we don't find out on time, it basically eats you up. It will spread all over your body, and death becomes imminent. That's why it's very, very important to bring awareness, to engage with our community, and to advocate, like Bright, they're doing, in Nigeria about screening. Because if you catch a lot of these cancers on time, you can actually cure a lot of them. I know for the area that I'm involved, which is urology, i.e., prostate cancer, kidney cancer, bladder cancer. If we find it on time, 100% cure rate on those. That's why it's very important, to do early screening. For prostate, what are early screening? PSA, a good rectal exam. Just like Bright, from Nigeria, their mammogram, they're saying from 40 years. It's the same thing with the prostate. If there is no family history, for our race, we say from 45 or 50. If there is a family history, remember that prostate cancer is very common in Black people. So 45 would be a very good gauge, to do the screening, which is a rectal exam and a PSA screening. For kidney, we say at least, by 50 years, just try to get an abdominal ultrasound. Make sure you are not, there is nothing, going on. If you have blood in the urine, that's a real indication that you should search for care. But I will stop at this time. But in summary, why it's dangerous is because if you don't catch it on time, you will die. Basically, that's the underlying, point. Thank you.
All right. So before we continue, we have the representative of David Omenukor Foundation in Nigeria. And now that the internet is still cooperating with us, and I hope it still remain cooperating. So we would like to, Dr. Bright to kind of update us on what is going on in Nigeria right now. What is David Omenukor Foundation is doing right now? What is the plan for maybe possibly the next 30 days, 90 days, and any information you feel our audience should know about. Over to you, Dr. Bright.
Yeah, Bright, just before you start, we want to know also, what is the level of awareness now on cancer with all you've been doing? Add it to your answer.
Okay. Thank you very much, Dr. Emmanuel. We first of all thank the Chief Executive Officer, Dr. Keyna Omenukor, who has been single-handedly sponsoring the projects and issues of cancer so single-handedly here in Nigeria. Just this month, 4th of February, we organized a campaign on cancer as the international has stipulated. And this year, because of the experience we had last year during the mammogram, that a lot of people, we had a surge and it overwhelmed us. So we felt that we should bring this message to the doorstep of the people. So we chose a location this year to the marketplace, one of the most populated markets here in the state capital. And when we got to the place, the screening point was just something that people were rushing, And another highlight or another point of capture in that exercise was that people stood still, learning how to self-examine themselves in terms of self-breast examination. The level of awareness is growing high because a lot of sister organizations are now joining. The age limit international bodies and medical practices have told us we've had a lot of cases of people who are not even close to that age, yet they had cancer. So wherever such information is going on, people will pause a while to understand what is happening, to try to know. We've been receiving a lot of information, a lot of calls, a lot of email as regards personal consultation or how to do it better on what they were doing before. So that was what we did on February 4th, and we hope to continue. In the next 30 days, being March, we will celebrate Colorectal Cancer Month, which is the main focus and main target of David Omenukor Foundation. Yeah, with the help of the Chief Executive Officer, we have outlined a number of programs to make the event colorful, both here in Nigeria and in the United States. Here in the United States, we will have free fecal occult from the 1st of March to the 31st of March and other programs. Here in Nigeria also, we are organizing a quiz competition for secondary schools all around the 27 local governments in Imo State. We want to test the awareness on cancer on these children, because when you are not informed, you are deformed. And if you get an information in the early stage of your life, it helps you to shape your future, shape what to eat, shape when to do exercise and other risk factors as long as cancer is concerned. That is one of the hallmark of events in the coming 30 days of what we want to do. Secondly, we have other programs we want to outline on that day, like jogging and other colorful events, which we will use to mark the Colorectal Cancer Awareness Month. And we are very, very sure that after all this, the awareness must have gotten, if not 100%, very close to 100%. Thank you.
Awesome. Thank you so much for that update. I mean, I always enjoy your reporting. It's like a CNN broadcaster. It's just, you see how I was being carried away by that report. Thank you so much for what you are doing. We might not be saying it always, but trust me, I always tell Dr. Keyna that you are a blessing. Thank you so much for whatever you are doing for David Omenukor Foundation. And I know even that, I mean, God himself knows that you are doing your best. Thank you so much. Okay, back to you, Mr. Alex. Or does Dr. Keyna want to add anything to what he has said?
No, he's right on point. I would like to welcome Dr. Agrawal. I think he's in transit. Dr. Agrawal, can you hear us?
I think you have to unmute him.
Yes.
Yes, I just landed. Thank you so much.
Oh, thank you for joining us.
I got delayed in the flight. I mean, supposed to land at 1 o'clock. Everything got delayed.
No worries. Welcome to the show.
We're glad you're here.
Okay, over to you, Mr. Alex.
Dr. Agawa, let's start with you. Let's welcome you by asking you to introduce yourself and to let us, we've been trying to look at why cancer is regarded as a very dangerous disease. That has been stated in the sense that it is a major
Sorry,
killer.
can you repeat the question? It's a little bit...
I'm saying that we have already treated why cancer is regarded as a very dangerous disease. They say it is a killer. It doesn't discriminate whether you are young, old, no matter the race, it can attack you. And if you don't do something...
Sorry, I'm having difficulty in...
You're not hearing me?
No, I'm not able to hear you.
Okay. Let me ask. Are other people hearing me?
Yes, we can hear you.
Yeah, we can hear you.
Okay, so the problem...
Yes, I can. Now I can hear
you. We can hear you now.
He said he can hear you now.
Okay, you can hear me now. Okay, so what I'm saying, as we have already looked at the dangers of cancer, why it is regarded as a very dangerous disease, Dr. Nwafo has already given us why they don't joke with it and they fight it bumper to bumper. And so let us not go back to that. Let us ask you, what are the best strategies to fight cancer and to avoid it? Are you with us?
The best strategy to fight cancer.
As well as avoid it.
Oh, the best strategy to find cancer. That's a... Yeah, so it's a loaded question.
And take the much you can.
Yes. I think I was listening to Dr. Nofer's the part of the talk on this show just now, and I agree with a lot of things he said already. That early detection is a must, and the best thing for there is no one right now. We do not have one single test. I can say that you can do a blood test or something, and you can find any cancer anywhere. So we have like these screening procedures for each cancer. For colon cancer, we have a different screening procedure, which is colonoscopy. For breast cancer, we have mammograms. For some of the pancreatic cancer, there are some tumor markers we can do. Prostate cancer, like Dr. Nofa said, PSA is very important. So for each cancer, we have a different strategy to find them, detect these cancer early. And like he said, if you can detect these cancer early, there is almost a 70 to 80% chance we can cure these cancers and nip them in the bud. Um, but there is no single test we can do to detect cancer anywhere, anytime.
Yeah, I also ask you, what do you suggest? Can it be avoided? How can you avoid cancer?
Well, the biggest thing you can do to avoid cancer is some of the things we know that are carcinogens for sure, 100%. Like smoking is a carcinogen. So, and this is smoking is just not related to cancer of the lungs. It is also related to cancer of the pancreas, bladder cancer. There are some correlations and there are some associations between these cancers. So, like avoiding smoking is a very simple and straightforward way to avoid a lot of cancers and other disease as well as like COPD. But in general, I would say uh, the best thing to do is a healthy lifestyle, which is exercise at least half an hour to 45 minutes every day, eat healthy, um, uh, try to avoid as much preservatives as possible, fresh food as much as possible, uh, and just healthy lifestyle. Um, you can avoid most of the cancer. But if you're smoking, that is first thing you can do. If you work in some occupations, you make sure that you wear some shields. Like if you are in the radiation department or radiation therapy or something close to radiation, you need to have something that is monitoring your radiation exposure. So these are some of the carcinogens we can avoid clearly and prevent cancer.
Awesome. Thank you so much. So before we continue, Dr. Bright just gave us an update of what David Omenukor Foundation is doing in Nigeria. And we have some testimonials which I believe it will interest our audience to listen to. So we'll be back after this short commercial break.
In a circular motion. Circular motion means no give around. In a picky mamma when you the capuro no genana. No genana. Because a bubble of Purano. I be cancer at the carry igagano. Oh, but me the capuro no genana. Do the shikagano log a megini. A wapia. Give you back and I give back and a babugi. Mamma won't hear the campuro neighbor. Only me let child when you know.
Awesome. So for the sake of those that didn't really understand those speaking in tongues, so maybe Dr. Keyna will update us what was that event, what were they doing, and how is it relevant to what we are doing right now?
Well, as part of World Cancer Day activity, David Omenukor Foundation, in collaboration with other NGOs in Owerri, Brecken, and they had a walkathon, and they went to the marketplace actually to educate the women and even the men that were there about creating awareness about the dangers of cancer and teaching them how to do self-breast exam. So it was demonstrated real life at the marketplace on February 5th. So that was what we were watching, and it was in Igbo language. And I'm sure Dr. Bright can have that converted somehow so that he can share it on social media so that other people can make use of the important information that was given that day.
Awesome. Thank you. Thank you so much. Okay, over to you, Mr. Alex.
Yeah, Dr. Wafo, let's get back to the issue of cancer, because that was why the World Cancer Day was celebrated, to create awareness, let people know the dangers.
Before we go to that, if you don't mind, Mr. Alex, can you read that questions? Maybe
I just did my first cycle of chemotherapy on Friday. I need to know what I can really eat. Ovarian cancer was the challenge. That is from Juliet Elise. So I don't know who takes.
That would be a very good question for Dr. Edward to answer. All right. And again, Ms. Juliet, thank you for sharing this information with us. This would be a good question for Dr. Edward to answer, for us to hear what he has to say.
Okay.
So I just did my first cycle of chemotherapy on Friday and need to know what I can really eat. Very good question. Basically, if you just did the first chemotherapy, some of the side effects of chemotherapy are nausea, anorexia, vomiting. And just to avoid that, the best thing you can do is do as much as possible more towards a liquid diet and avoid some fatty foods, because that may enhance some of your nausea and vomiting. So just avoid fatty food, avoid sodas like Pepsi, Coke, anything with the carbonated drinks might make a little bit of more nausea or anorexia and maybe gastritis. So just avoiding, and just take your medicine and you'll be fine. Sometimes we have to use antiemetics like Phenergan and Zofran to prevent this nausea, vomiting. But basically you can eat anything. Try to do more of liquid stuff, liquid for at least first few days, 3 to 4 days, and then you'll be fine.
Awesome.
I just wanted to add, in case she was also referring to as a cancer patient, what type of diet could you would she be eating? Like Dr. Agrawal said, you can basically, while you're going through chemotherapy, you might get sicker, you might lose, you might be fatigued, you might be like you're not eating very well. So what's more important at this time is to make sure you get some nutrition into you. Then when you're stable, you start looking at those things that can cause cancer or can make the cancer worse, like making sure that you eliminate sugar, sodas, and eating more healthy foods, vegetables, seeds, nuts, more of those than eating carbohydrates, which will eventually be converted into sugar. So I just wanted to add that in case, your question was what type of diets could you take after your chemo, nausea, and treatment is stabilized.
Thanks for this update. Yeah, that's very true. I mean, avoiding sugar in general is very good anyway. So so I would avoid sugar and fatty foods. More proteins are always helpful in any kind of cancer diet, because your body will break down some muscles and proteins when you're going through the chemotherapy. So heavy on proteins, unless you have kidney failure or kidney problem, that should be your main thing in your diet.
Awesome. Just to kind of come in, I know Dr. Francis sent an image in, so just for us not to forget that, and to be able to create time for us to demystify the content of that image.
No, actually, basically, the whole gist about that image goes on a couple of things. Our body is like a car, right? I mean, this was actually designed by the American Urological Association. Our body is like a car. You have to take care of, if you take good care of your car, you will last a long time. What happens is sometimes for us that are, we always assume we are so busy, therefore we could not exercise. You've heard Dr. Edward talk about how important exercise is. If you look at reducing stress on this cartoon, exercise helps to accomplish all that, to help you, achieve your goals. Number two, for us human beings, we need to take responsibility. We just cannot assume we are so busy, chasing money and stuff like that without taking good care of ourselves. We need to eat healthy. We need to drink, good fluid. And also we have to, observe the early warning signs. We talked about screening. We also talked about awareness. Sometimes even for us that are here, I really commend Bright in Nigeria. They are doing I really like that demonstration. It's very good. And for the organizers, I strongly encourage you guys for also have something targeted, maybe with the Nigerian Physician Association, the Nurses Association, the Nurse Practitioners Association, to actually drill that on our, on our own people here in the States, to really take good care of ourselves. It's very important. It really coincides, this talk, coincides with, Black History Month, awareness. We've seen, the effect of COVID, that actually the less privileged, are raised, we get hammered. So it's very important. And that's basically the reason I want us to put up this. Thank you.
Okay, thank you so much, sir. And just to kind of put Dr. Keyna also on the spot right there. So, like, what the walkathon that David Omenukor Foundation organized in Nigeria? I know David Omenukor Foundation has had kind of walkathon also over here in US before, but believe since we started this program, since COVID hit, there has been nothing of that nature. So, is there any plan by David Omenukor Foundation for the walkathon, or is it COVID that is preventing or stopping it? Is there no COVID also in Africa?
To answer your question, yes, COVID was the reason that most of our activities, both here and in Nigeria, was curtailed. Every month there is a new variant of COVID and the other. And it's really not just that is all the excuse that we could use, but there are so many other factors. But we thought we would do one for March, but instead we decided that we would for colorectal cancer awareness month, instead of organizing a walkathon this year, because people are still skeptical about coming out wearing masks. It's very uncomfortable to do such activities. So we would offer free fecal occult kit for the entire month of March. If you come through Crystal Family Clinic, we will give you a free fecal occult. We will give you some consultation and some referrals and resources where you can, if you're uninsured or underinsured, we can give you resources where you can get free colonoscopy or subsidized rates for colonoscopy. But Crystal Family Clinic will sponsor for anybody that walks through the clinic beginning March 1st through to March 31st. We will do a free fecal occult for you.
So pretty much most people that would like to enjoy that benefit might possibly not be on this show right now. So what is the plan of David Omenukor Foundation to get that information out there?
That information is already on social media. Okay. We will continue, we'll put it up on our website. And my phone number is actually there on Facebook. You can contact me, you can contact the clinic, and we will put up, the phone numbers later on the show so that you have them.
Awesome. So let me stop dragging Dr. Keyna's feet. Let's get back to the show. Over to you, Mr. Alex.
Yeah, Dr. Wolf, let us look at, even in the practice, And from what you just said, the video we just watched, it appears you are sufficiently concerned that, and from your experience, you seem to be concerned that awareness is not being created. Enough awareness is not being created. And you also you are appealing that more awareness to be created. So let's start the awareness right here. We're already talking. So what are the areas? How can people who have cancer access medication? And what do you advise people who are also struggling? How do you advise that this awareness could be spread in addition to what you have already done? Because it is part of the way to reduce cancer.
Very good question, Mr. Alex. Number one is that we have the privilege in this discussion of talking to a member of the largest cancer group, Dr. Edward. The Texas Oncology is one of the largest cancer group in the country. So that's really huge. And I really think, that awareness in our community should be, made aware that, what you guys are doing or what we're doing is not a child's play. So a lot of those referrals should go to him, colorectal, ovarian, any kind of blood disorder. They do it all. They have all the people on their, on their range. For me, what I usually do is somebody with, elevated PSA, they come to me, or blood in the urine. If I diagnose them with let's say like, prostate cancer, we'll talk about all the stages at that point. If it's the ones that, surgically we can treat, we take care of that. If the ones that will require radiation, chemo, I call Dr. Egwo. I have his, you all saw that. I have his cell phone number. I've known him for a very long time. If it's not the area that he treats, they have people in their group that he'll send us to. So that's very important. That's the privilege we have here in the States. What happens is a lot of our people, sometimes we don't take care of ourselves. I keep saying that. We really don't take care of ourselves. We spend so much time doing other things that are to me, is really irrelevant. So that's very important, on this discussion. How you guys can help, you guys, I mean, this is a great forum, Alex and Emmanuel, that you all have created. We should also take it one step, maybe get involved with the Nigerian physicians or the Indian physicians or stuff like that. And I've seen a very good job that, the Black Americans we've done, with awareness, with the COVID, the exposure that it shows, that our race are not really, that we're below. We are not doing well. And with all this, now, the vaccine rate is very high in our community. So it's very important. Responsibility, education is also important. Who are best, educated patients? They take care of themselves. So it's very good also to educate our people, so those are the kind of, things I will want us to do. There's a lot of our, people here, and we should really step it up in whatever way we can do. Thank you.
So thank you, Dr. Nofer, for this. We need to, one of the very good sites for awareness for general public, and I'm glad you're doing this show, because I think you're reaching a very large population all over the world with this show. And I'm sure people are tuning into this show even after we have done this. But one of the best resources for awareness for everyone is American Cancer Society. And it has all the kinds of knowledge, all the kinds of references for cancer treatment, basically all over the US. It's mainly for the US. So American Cancer Society is one of the things I refer most of my patients to go to if they need any resources or anything. The other side is more for the medical professionals, But even for the patients, this site is becoming very popular. It's called NCCN guidelines or NCCN site. And it is becoming very popular for the patient because they have patient portal on this site, and the patient can access this site, and it's all free. Both American Cancer Society and the NCCN guidelines are all free for the patients, and they can tune in, log in, and get any information about any cancer at any time. It's 24/7. The other site is American Society of Clinical Oncology has also a patient portal where they can ask questions from the experts in different fields in cancer. American Society of Clinical Oncology is one of the largest cancer societies in the world with over 100,000 oncologists. And they have a site now created that if someone has a question and they want a curbside or something, they can ask for an expert. And that is also like free. So these are the three things I would recommend for patients. And I'm glad you're bringing in through this broadcast that some of these patients can get help through this. I get some questions through these sites also, which I handle as much as I can. Wow. But thanks, Dr. Wolfer. I mean, these are kind of things more and more we have to propagate for the awareness of cancer and treatment. There are a lot of, actually, the problem with the cancer treatment is there are a lot of misconceptions and misknowledge on the internet. There is so much of misinformation. That's what I worry more about in cancer treatment. And I mean, these are the very standard sites. I mean, some of my patients, they land up in different countries like Mexico, and they get weird kind of treatment, and they spend thousands and thousands of dollars over there, which has no proven efficacy, and they come back with more advanced cancer. And some of these patients, they just succumb to that, and they've spent a lot of money on this misinformation. So this is very important thing you have asked about the awareness, because there is so much of misinformation on cancer treatment and cure and everything. There are some people who are just talking about their miracle cure in cancer and messing up these patients.
Wow, that is great. You've given us very important resource areas where people can really go and get help. American Cancer Society, NCCN, and they have their guidelines, because we were already interested in letting people know where they can always go and get help. And then American Society of Clinical Oncologists. That is
and
great.
These are all free sites. Anyone can this thing, and these are very, very reputed sites. And all the members in this site are board certified. Most of these are board certified oncologists and hematologists. And I mean, those are the best ones, I would say, for the patients. Thank you Alex. Thank you really for bringing it up and broadcasting on this site. I hope some people take note of this, and so that they don't get. I'm more worried about these patients are getting sucked into some of these treatment and spending, like one of my patients spent like $40,000-$50,000 going to Mexico, came with widely metastatic disease, and
Wow.
she was getting breast cancer, which was very curable, very 100% curable cancer. When she came back to me, this was so metastatic disease after spending $50,000 that eventually she died.
Yeah, and that takes us how we can support those also who have survived from cancer. A lot of people survive from cancer, and they live in fear. So how can we support them psychologically, emotionally, and otherwise? Dr. Wanfo, let me start with you.
Well, number one is how can we support them emotionally?
Yes,
yeah, how can we support them emotionally? What do I do in my clinic? Let's say, somebody, typical example, somebody with elevated PSA, I do a prostate ultrasound with biopsy. I tell them they come back in a week, we look at the report. What I usually tell them, I look at the report depending, on the grade or whatever. I will tell the patient, I said, that biopsy we did, it came back prostate cancer, but it looks like based on the PSA and the grade of the tumor, I said, more than likely your cancer is localized or it's not, If it's localized, I will tell them, I say, we have a lot of good treatments for you, you know, and we will discuss all the treatment options. If it's localized, we'll talk about surgery, we'll talk about radiation. There are even some low-grade, prostate cancer, like glycine 3+3, one core. Now we're finding out that those are very low grade, that they don't actually require treatment. What happened? A lot of patients, once they hear that word cancer, it's very stressful. But you reassure them at that point, that this is very low grade. It's only one area, and that you're gonna live. Patient appreciate that. If it's something that, high grade or whatever, you talk about all the strategies. What do we do? If it's somebody that will require radiation or a chemo, being that, that's why it's important to go to specialists like us, Dr. Edward, we'll be able to send them to resources, where they will get the best care. As you know, at least here in Dallas Metropolis, we have a lot of fine hospitals. All these, big hospitals, Baylor, Methodist, Presbyterian, UT Southwestern, we all have it here, in Dallas. So we can refer them, resources. Well, I would advise, Bright, in Nigeria is also, keep working, hopefully our government will have a change of heart, at least to have areas, that some of these patients can get care. They come here and get care. Why couldn't they take care of our people? So being, holding them accountable is also very important. But we're here to help. This is a calling on our profession, healthcare. We're here to help. We love to help, our human beings. So that's what I will advise. Thank you.
Yeah, and I just want to add a few more words in this. This is a very important in my cancer patients. It's like we used to say in India, once bitten, twice shy. So once you have cancer and you've gone through chemotherapy, the worst thing a patient wants to hear that your cancer has come back. So this is a very important that they need to keep following at least once every 3 months to every 6 months, depending on what kind of cancer it is, with oncologists. Most of the time, and I'm repeating the word most of the time, if they've not come back within 2 years, the chances of coming back becomes very, very small, to the tune of less than 10 to 20%. So first 2 years are very important in their follow-up. And there are so many now these days on internet, there are so many support groups people can join. For each cancer, each disease, there are support groups. I encourage them to join those support groups and follow them very closely for at least 2 years. And once they are gone past 2 years, I can pretty much assure them that their cancer is not going to come back and they can just relax. But again, that anxiety will always remain and it's very hard to deal with it. There are so many other things that they can do for anxiety and this thing, and that may be another topic for another day. But initial follow-up for 2 years is very important in cancer care after treatment.
All right. So before we continue, as we know our time is fast spent and we are coming to the end of today's show. So I don't know if Dr. Keyna would like to ask any follow-up question or any statement from what has been said.
Well, yeah, just to piggyback on Dr. Agarwal and Dr. Nwafor about how to help the patients cope with their disease, or even after they are cancer-free, to remain healthy, follow up with their appointments. If they're so stressed also or have anxiety, and sometimes they go through depression, there are counselors out there too that can help them, go through, walk through the disease condition and the after effect of chemo, and just going through cancer treatment. It's it's a very distressful disease, a moment, it's like a life-changing moment. So they need that support. So sometimes they might end up just going for some therapy, including sometimes having some medications to help them through.
Okay, over to you, Mr. Alex.
Yeah, Dr. Nwafo, you had already gone to this area, but you scratched it. And that is the issue of what to do to our brothers in Nigeria who have the same challenges that we have here, but they don't have anything to start, taking care of their system. So you have already said you hope Nigerian government will have a change of heart and begin to provide what it takes. But beyond that, do you think there is something you professionals can do in trying to help this terrible situation they find themselves in Nigeria, or would they have to wait when their kingdom comes?
Well,
Dr. Nwafo, before you answer that question, I just want to remind us that this year's theme for Union of International Cancer Control World Cancer Day is closing the care gap. So now go ahead.
Well, no, Alex, we are always doing something. The Nigerian Physician Association, they have medical mission that they go, every year. And, continually, we are, upgrading it, doing the best we can. The biggest challenges that we have is really when you diagnose somebody, with a localized cancer, not having a small center that one can be able to treat, these cancers becomes challenging. And some of them are really requires a lot of money, to set up. Some of our donations and stuff like that, I really think is something, a collaboration between the government and some of, our professionals to have some of the centers, for example, like a radiation center for some of these places, a good small surgical center that will have most of the facilities. What do I mean by that? A stable electricity, a good water, really being able to take care of whatever little equipment, that we have to be able to do a successful surgery. That's what I mean by that. And, it's really very unfortunate, that our government, both at whatever level, the very rich or whatever, because they have access to immediately, leave the country and come to other parts of the world to get care, don't really think in that direction. I mean, the Indians have done it. You can see that now, people can go to India, and get a decent care. I really think, that our country should also be thinking in that direction. Now, they're heading to Dubai or whatever. Why can't we just have, I'm not saying all over, but just a small centers of excellence that we can be able to, take care of those. The physicians are trying, the nurses, everybody, we all want to help. But what happens is that you go to some of these medical missions, you diagnose somebody, but you don't have a place to really take care of them, or the limit of what you can do becomes very limited. That's what I'm talking about.
Yeah, thank you, Dr. Nofer, for kind words about India. But let me warn you something, because I'm from India originally. I've been here for 30 years. There is a lot of fraud going on there. And the problem is that there is a clear-cut fraud where people are just fleecing people. The second thing is there is a lot of incompetence in diagnosis. I get some of these slides back from India to here and reviewed, and some of the cancers they've diagnosed, like they diagnosed someone with non-Hodgkin's lymphoma, turned out to be totally different Hodgkin's lymphoma. Some patient they diagnosed with cancer, when we reviewed the slides here, there was no cancer. The patient unnecessarily got chemotherapy and radiation for no reason. So be very, very careful in referring any patients to India, because people are, I don't know, it's not same. I'm very, very terrified I'm sorry for, thank you for the kind word, but be terrified when you send someone to India.
Wow, that is
I'm so
something else.
sorry. I'm telling you, people are unscrupulously dishonest.
Wow.
That's the future.
And the
Is
thing
the
is,
future of
the
the third
problem
world.
is there is no law to protect the patient there. Any doctor can go get away with anything there. In America, that is a very good thing, that I cannot get away with anything. Everything has to be written. Everything is documented. All the biopsies, everything before I do the chemotherapy. That is why one of the reasons I'm with Texas Oncology, which became one of the largest group, is everything I do is being reviewed by my peers, and there is a whole committee that reviews what I do even before the patient can even get it. So it is being reviewed by like 3 levels they're being reviewed whatever I do by my pharmacist. He makes sure that I do the drugs right. I'm not doing anything wrong drugs. It is being reviewed by my nurses. And then there is a whole review committee in Texas Oncology that reviews my chart at random. And if there is something wrong with me, they will throw me out. So I'm very mindful of everything at every place. There is no such process in India. And I have changed the treatment and everything in so many patients, believe me. Thank you again for the kind word, but be very careful about India.
This is so revealing, and this is a big message for
yes, and I know the
Nigerians.
inside story there. I know how people were unscrupulous even in this COVID times. There were these hospitals who were diagnosing these patients with COVID and charging them $10,000-$20,000 and admitting them for nothing without even COVID, just to make the money. And then 3 days later, they discharge them. Oh, your COVID is cured. And they'll kick them out after the money is gone.
Wow.
Well, I guess that sounds really a little bit relieving for some of us from
Yeah,
Nigeria.
I'm so sorry. Be very careful.
Okay.
That's a very good point. But again, like what I'm saying, like what I'm really saying, in summary, again, for us, the healthcare here, we have those medical missions. We go there. Those are the frustrations, that we face, in Nigeria. And I think we can do better. There is no specialty, at least in Dallas Metroplex, that you cannot see in Nigeria. That's very, it's so we're our mind and souls are there. But Alex, you got to understand also the limitations. Some of these, cancer treatments or whatever require some kind of, money to buy the equipment and to maintain it. To also maintain it. That's the challenge we have.
Wow, a lot has been said, and even though as we are tidying up to this show, I just want to play with our audience. You see, this is a lot of information that people out there need to see. So all you can just do to be supporters of this show is to like this video if you are watching on YouTube channel, and make sure you subscribe if you have not subscribed before. Smash on that bell button so that you will be notified whenever any new video is uploaded, especially on this YouTube channel. Then share this video with somebody. Just share it on your profile, share it on your network, share it on Facebook. It doesn't cost you anything to share. It costs all these panelists a lot for them to be on this show. Look at somebody like Dr. Agawa. I believe he's still right there at the airport. He just arrived. He has 1,001 excuses not to be on this show, but he still managed to show up. So all you can just do is share this video with someone. So let's begin to tidy up this show as we begin to bring what I call our elevator speech. 1 minute summary of what you want your audience or our audience to go home with today. And I'm going to be starting from Dr. Francis.
Again, thank you for inviting me to this forum. It's very good. I highly recommend it, and I want you guys to continue on your mission. Basically, the picture that I showed you is like our body is like a car. You take your car to tune up, you maintain your car, it will last you a long time. So make sure that once a year, that you get blood work. If you are at the age to get a mammogram, make sure you get that. If you are the age to see a urologist for a rectal exam, PSA check, try to get that. Colonoscopy is very important. Abdominal ultrasound once in a while to make sure there's nothing sneaking on you. And we are always available to help and also be your brother's keeper. Thank you.
Thank you so much, Dr. Francis. Over to you, Dr. Garo.
Yeah, thank you so much, Dr. Francis. That was very nice summary. And thank you for having me. And thank you for increasing the awareness about the cancer all around the world, especially in Nigeria. I hope people are listening to this. There are some very important points in this show made. And please keep doing this and see if we can get some sponsorship. I'm still pestering my organization to sponsor some of it. But I'll keep trying. Maybe one day it will happen. But you guys are doing a great job. Keep it up. Keep up the good work. And thank you for having me. Really appreciate
it. Thank you so much. And we say amen for God to answer your prayers about getting scholar sponsorship for this show. And I believe our viewers, they are watching right out there. This show needs to go beyond just this level. Okay, over to you, Mr. Alex.
Yeah, my takeaway today has to do with the resources that has been announced for people to make use of, and that is people should always contact American Cancer Society, NCCN, and be able to know their guidelines, and American Society of Clinical Oncologists. That's the information I think everybody should go home with today. Thank you.
Awesome. Once again, my name is Emmanuel Adegbola. I'm the co-host of today's show. But before we bring in the host of this show, to just wrap up the program today and say thank you to our audience, join me as we see once again what David Omenukor Foundation is doing back home in
David Omenukor Foundation. Global Crusade Against Cancer. The 2021 free mammogram exercise by David Omenukor Foundation started on the 22nd of October in partnership with Everright Diagnostics. The CEO of the foundation, Dr. Keyna Omenukor, flagged off the free mammogram exercise.
Awesome. So welcome, Dr. Keyna Omenukor, and she wraps up today's show.
Wow, what another wonderful show. I want to thank Dr. Agawal and Dr. Nwafo for treating this topic, the same normal way you usually do. Wonderful information, new information every time. I want to thank our audience all over the world. I hope that you picked something from today's show like you normally do. And we will continue to bring you this information that is life-saving information so that you will continue to live healthier lives and reduce your risk for cancer and all of that preventable diseases. The most important thing is to make sure you eat healthy, exercise, cut out smoking, decrease alcohol intake, reduce preservatives in whatever you eat, limit your contact with X-ray, radiation, reduce stress, and decrease carbohydrate intake, maintain a healthy weight. And most importantly, make sure you get your screenings done and go see your doctor at least once a year. Thank you for watching our show today, and we'll see you very soon.